Vice President Biden, some medical experts are saying the only true way to control this virus is through a national quarantine, requiring every American other than essential personnel to stay home. Would you take that unprecedented step of a national lockdown?
What I would do is what we did in our administration. I would call a meeting in the Situation Room of all the experts in America dealing with this crisis. I would sit them down and I would do exactly what we did then. What is it that we need? Listen to the experts. What do we need? And with all due respect to Medicare for all, you have a single-payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single-payer system. Now, with regard to what else I would do, the fact is that we're in a position where I would bring together the leading experts in the world. Instead of doing this in the United States, instead of doing this piecemeal, sit down and do what we did before with the Ebola crisis. What is needed? And have one voice, like we did every day we met in that crisis in the Situation Room, laying out, so we lay out overall for all the nation what the best proposal is and how to move forward. In the absence of that, governors are making some sound decisions. They're doing the best they can by going out and getting the healthcare experts in their communities and their states to move. But it should be directed from the White House, from the Situation Room, laying out in detail like we did in the Ebola crisis, and we beat it.
Thank you. Senator Sanders, your response?
Well, first of all, the dysfunctionality of the current healthcare system is obviously apparent. As I said earlier, there are people who hesitate to go to the doctor. You're going to have a maze of regulations. Well, if this is my income, if that's my income, can I get it? Can I not get it? Clearly, we are not prepared, and Trump only exacerbates the crisis. When we spend twice as much per capita on healthcare as any other nation, one might expect that we would have enough doctors all over this country. One might expect that we would have affordable prescription drugs. One might expect that we are preparing effectively for a pandemic, that we were ready with the ventilators, with the ICUs, with the test kits that we need. We are not. And bottom line here is, in terms of Medicare for all, despite what the vice president is saying, what the experts tell us is that one of the reasons that we are unprepared and have been unprepared is we don't have a system. We got thousands of private insurance plans. That is not a system that is prepared to provide health care to all people. In a good year, without the epidemic, we're losing up to 60,000 people who die every year because they don't get to a doctor on time. And clearly, this crisis is only making a bad situation worse.
That has nothing to do when you're in a national crisis. The national crisis says we're responding. It's all free. You don't have to pay for a thing. That has nothing to do with whether or not you have an insurance policy. This is a crisis. We're at war with the virus. We're at war with the virus. It has nothing to do with co-pays or anything. We just passed a law saying that you do not have to pay for any of this, period.
That's not true. As a matter of fact, that's not true. That law has enormous loopholes. I understand that Nancy Pelosi did her best. Republicans prevented it.
No,
what you're talking about, Joe, here is enormous loopholes within that in fact, it is not necessarily covering treatment for all people in America, and that people are going to be stuck with a bill unless we change that. And we're going to offer legislation to, in fact, change that.
If I may, I offered legislation. I laid out on my plan that it would cover exactly what is not covered by the House. I laid out in the plan that I laid out for how we would deal with this crisis. Nobody will pay for anything having to do with the crisis. This is a national emergency. There isn't a question of whether or not this is something that could be covered by insurance or anything else. We, out of the Treasury, are going to pay for this. It's a national emergency.
But you see,
that's what my plan calls for.
But the weakness of this is, let's just do a hypothetical. Family members diagnosed with the virus. Yep. Terrible tragedy, massive anxiety. The wife has the virus, the husband is a wreck, wants to go to a psychologist, wants to get counseling, doesn't have the money to do that. Maybe their kid breaks a leg. they don't have the money to go to healthcare. So you're saying right now in the middle of a crisis, but you know what? Last year, at least 30,000 people died in America because they didn't get healthcare when they should, because we don't have universal coverage. I think that's a crisis. 1 out of 5 people in America cannot afford the prescription drugs they need. They suffer. Some die. I consider that a crisis. Bottom line is, we need a simple system which exists in Canada, exists in countries all over the world. And that is, if you are an American, you get the health care you need. End of discussion. We can save huge sums of money doing that. The trick is, do we have the guts to take on the healthcare industry, some of which is funding the vice president's campaign? Do we have the courage to take on the executives at the prescription drug industry, some of which, some of whom are funding his campaign?
Look, this is a national crisis. I don't want to get this into a back and forth in terms of our politics here. I've laid out a plan, building on Obamacare, providing a public option of Medicare that would cover everyone the same way. This idea that this is his only answer is a mistaken notion. But regardless of whether my plan was in place or his, this is a crisis. This is like we are being attacked from abroad. This is something that is of great consequence. This is like a war. And in a war, you do whatever is needed to be done to take care of your people. And what you do is and I have proposed it and laid it out in detail. Everything that you need in terms of dealing with this crisis would be free. It is paid for by the taxpayers generally. Generally. It has nothing to do with Bernie's Medicare for all. And by the way,
Vice President Biden, thank you.
I'm